Today we're going to go over the instructions for your pre-op and post-operative needs for your closed scarless rhinoplasty with me, Dr. Dugar. Pre-operatively, for 1 month, we recommend no caffeine and no alcohol, and definitely no smoking. I know it may be hard to quit caffeine or alcohol, but try your best to limit it because these can all increase swelling. The other things that you'll be doing as part of your regimen will be ARNICA tablets. ARNICA tablets will give to you either by mail or in person. These will come in little tubes, and what you do is you place these underneath your tongue and they will dissolve. You'll be using this twice a day and you'll dissolve 5 tablets under your tongue. The way it works is you will just twist the top of this and release the little tablets, and as you release the tablets, you'll drop them into your mouth and dissolve these under your tongue. You'll also be using MUPIROCIN ointment, which you'll also be given or be mailed to you before surgery. This is an ointment that you'll use inside your nose twice a day, inside with a Q-tip, in order to sterilize the inner mucosal lining of your nose. You'll be using this twice a day before surgery, but 5 times a day after surgery. More of that to come. Post-operatively, we hope you have a very pleasant experience. Most patients don't complain much of pain, but you'll be provided pain medication to be used just in case, but most patients prefer Tylenol. We also recommend complete abstinence of use of any anti-inflammatory medication such as Advil or ibuprofen that can thin the blood and cause bleeding. Post-operatively, we're going to give you a nasal drip pad to wear underneath your nose. This nasal drip pad will be filled with little pieces of gauze that you'll roll into a small rectangular shape and place within the gauze drip pad and place it right underneath the nose and link it behind your ears. This will be done to collect any mucus or drainage that happens after the surgery from your nose. If you're not draining or bleeding, you don't have to wear this. Usually you'll need to wear this for the first 1 to maybe 2 days, and then thereafter you usually don't need it. We'll give it to you to maintain just in case though. The other thing you'll be doing post-operatively is the MUPIROCIN ointment. This is the ointment that we gave you to use inside your nose before surgery twice a day. Now you'll use inside your nose 5 times a day. We recommend using a significant amount inside the nostrils on both sides of the nose in order to coat the entire nose and all the cuts with ointment to keep it as moist as possible. If you had a septoplasty procedure performed at the same time as your rhinoplasty, we'll also recommend using oil. For you special patients, for 2 days you have small cotton ball sponges inside your nose that'll be removed 2 days after surgery. The day those come out, we're going to provide you with apricot oil and an eyedropper for your convenience. You'll be drawing up the eyedropper with the apricot oil and releasing 1 drop and 1 drop in each nostril, and then gently sniffing it back like that. And you'll do that multiple times in order to get the oil to coat all the way to the back of the nose. You'll also be using Arnica cream under your eyes. Most patients might get some bruising and swelling. Although some patients don't get any, we still recommend use of Arnica cream under the eyes. We recommend using just a tiny dab on the lower eyelids only. You can put it on the upper eyelids, but the reason we don't recommend it is because it can get goopy and stuck in your eyes. It's not dangerous, but you'll have to blink about 20 or 30 times to clear it from your eyes. So we recommend just a light layering of this on your under eyelid. And perhaps the most important task that you'll be doing post-operatively is icing. We prefer you to use our ice glove technique. So don't buy any ice compresses, don't buy anything from the store, don't use frozen peas or ice blocks. Only use fresh gloves that we will provide, and we ask you to kindly buy more at your local pharmacy and fresh ice, which you can get out of your fridge or freezer. What you do is you place an ice cube in each of the 4 fingers to give 1 ice cube in each of the 4 fingers, excluding the thumb. Once you've done that, you'll place a knot between the thumb and the wrist of the glove in order to prevent any ice from melting and spilling out of the glove. Now you have 1 ice cube in each of the 4 fingers. This ice cube will go directly over the eyes. We recommend using a Kleenex to place over the face, and then an ice glove goes over the eyes with 2 ice cubes over each eye, just like this. And you'll continue to use your Arnica tablets just like you did preoperatively. You'll use this at least 3 times a day, and you'll again place 5 tablets underneath your tongue. And you'll place 5 tablets underneath your tongue. Just by twisting it, the tablets will release, and you'll let these dissolve under your tongue 3 times a day. And should you have any other questions or have any concerns about anything at all, just please call us at our office, 310-276-1703, or feel free to text us for any non-urgent questions. We're here to help you 24/7 with anything that comes up while you're recovering from your scarless nose procedure. Usually patients are back on their feet and back to normal within 2 to 3 days, in 7 days until the cast comes off, and you can resume all normal activities. We wish you happy healing and all the best.